Good day, friends. I'm Professor Sujoy Ghosh, endocrinologist, IPGMER, Kolkata. India is a young nation with 40% of the population being less than 20 years of age. And therefore, it's not surprising that the government of India has decided to launch a new version of the RBSK, that is RBSK 2.0. And as part of RBSK 2.0, the government of India has published the guidance document for diabetes mellitus in children. And in this video today, I'm going to try and take you through the minimum basics that we need to think of when we are trying to establish a childhood diabetes clinic in the district hospitals of our states. Now, the first thing to do is, please do read the guidance document so that you have an overall idea of how the clinic operates. Obviously, in a subsequent document, that is the operational guidelines for diabetes in children, you will find greater details. And with that checklist, we will be able to decide upon the list of things that you need in terms of the physical infrastructure, the human resource, and the consumables. So let me take you through the guide or the trip of setting up such a clinic. The first thing in the checklist is, where is the clinic located? Is there enough waiting space? Is there a washroom? The washroom also helps in collecting urine samples, which is also important. When you're looking for the facilities within the clinic, you need adequate space to ensure that several of the following things that I talk about is available. First of all, there needs to be a space where the doctor sits, that is the pediatrician as well as the adult MD medicine has enough space to examine the patient, and there is enough tables and chairs, an examining couch, an area for the nurse to sit, the NCD counselor, along with the clinical nutritionist and a clinical psychologist if you have, as well as a data entry operator if you have the privilege of the same. The other bits in the infrastructure that you will need is a computer, a printer, and internet facilities for data entry in real time and e-prescribing. And you will have to have an almirah wherein you can keep all the printed material, that is the IEC material, the registration card, the patient diaries, the glucometer diaries, the glucometers, the strips, the lancing devices, the needles, the syringes, all of them can be stored properly. Remember, as part of the program, we insist that there is a mini pharmacy within the clinic itself. So apart from the stores that I've already talked about, you have to have a refrigerator, which obviously should have a lock so that it can be locked and kept secure, where you store the insulin supplies for the patient. Remember, it is absolutely essential that the stock of insulin does not run out, because insulin is life-saving for these children. Additionally, we need certain other equipments, a weighing machine to measure the weight of the patient, a stadiometer for measurement of height, blood pressure instrument with correct size blood pressure cuff, and stethoscope and an ophthalmoscope, and instruments that are needed to check for neuropathy. Additionally, you will need other things for collection of blood samples and urine pot for urine tests. We would encourage that as far as possible, these test samples are collected in the clinic area itself as much as possible to prevent dropouts of investigations that often happens if the individual has to go to 3 different places in the hospital. For the clinics, make sure apart from standard tests, which are like creatinine, lipid profile, LFT, one of the major components of this clinic, as part of the thalassemia screening program, each of the district hospitals are supposed to have an HPLC machine to do HbA1c. So we should be looking at all of them as well. Typically, the child would be referred to the childhood diabetes clinic, wherein the first point of contact would be the clinic nurse. Now, the clinic nurse is supposed to maintain a diabetes clinic register, wherein the patient's detail would be entered after checking the ID of the patient. And the child would typically be given an ID card, which he or she will be carrying in all subsequent visits. Now, depending on the application portal through which you are filling in the data, you would register the child on the portal as well, so that the data remains on the portal and through the computer system itself, all of the history, examination, investigation and the treatment given will be documented and an e-prescription will be generated. Just like the adult NCD clinic, these children will also be given a diabetes case diary. Now on first visit, either the pediatrician or the adult physician, depending on the age of the individual, would be taking a proper history, documenting the anthropometry, the examination findings, and then depending on the basic investigations, make the basic prescription and another set of investigations might be asked for. So all of that detail would be filled in the patient diary as well as the e-portal system. Now the child would be moving on to the NCD counselor in the clinic. We do understand that some clinics might not be having an NCD counselor, in which case the clinic nurse will be doubling up as the NCD counselor, and the NCD counselor will be educating the child as well as the family regarding a lot of things. Now we've created some IEC material which could be distributed and given to the child, and remember there's a lot of education that needs to be given to the child. Don't try to overload the parents and the child with information on the very first visit. We would only be talking about the insulin injection, how to store it, how to inject, how to rotate sites, when to change needles, and the basics of how to check blood glucose through a glucometer with strips, and basics of dose adjustment, detection of hypoglycemia and its management and its prevention. As we go along, there will be other topics which will be more difficult to understand and explain, which we will have to go on discussing with the patient, typically to be done by the NCD counselor. In subsequent visits, we usually cross-check what the patient has learnt in the previous session. Remember, we would also encourage each of the clinics to hold camps at regular intervals, maybe every 3 months, so that what you could not deliver in a busy clinic, you would be able to deliver group education so that the child and the family is able to cope better with all of the nuances of childhood diabetes. Additionally, some of the investigations and tests can be done during those camps. Also, what we would provide to each of these children is a log book for checking the blood glucose with the glucometer and the syringes and the needles, and they would be documenting the glucose readings in the logbook. Once this bit of explanation is done, the NCD counselor will also demonstrate the injection technique and how to check blood glucose. There should be some area of privacy within the clinic where this can actually be demonstrated in the clinic. Once that's done, with the prescription and with the knowledge that the child and the family is empowered with, they will come back to the clinic nurse for dispensation of the drugs and consumables. We suggest that in the clinic itself you have a mini pharmacy, so that dispensation of all the consumables, drugs, etc. are done from the clinic itself. So of the things that are given to the child is a 100 IU syringe along with insulin glargine. Remember, always match the strength of the insulin with the strength of the syringes provided. Secondly, 40 IU insulin syringes with 40 IU human regular insulin. A glucometer would be provided at the beginning, and we would be providing strips, typically 100 strips per month to the child. A lancing device is provided, and needles for each month is provided along with the lancing device. Additionally, we also share the rotation grid so that we avoid lipoatrophy and lipohypertrophy, and that the proper rotation of injection sites are done. So with all of this, you should be ready to start your clinic. So I have tried to give you a brief idea of how an ideal diabetes clinic in children should be set up in the NCD clinic of each district hospital. And with that, let us hope we are all able to transform childhood diabetes care in India. Thank you very much.